because of sheer geographical challenges. Also, we already no longer extract or demand fees for taking the UPCAT. It's already free. The UP, we already showed that with our own budget. The other thing is that we introduced associate in arts degree, and in order to take care of those students who, because of disadvantaged high school, cannot compete in the UPCAT because UPCAT is blind to your high schools, whether you're elite high school or an ordinary high school. So we're opening associate in arts degree. These are 2-year certificate degrees, and that serves as an UPCAT. Their general weighted average in 2 years will serve as this UPCAT. If they meet the standard, they can proceed to a regular bachelor's degree after 4 years, after the second year. So this is one of our innovations when it comes to increasing access. Also, there's an average of about 1,400 students a year who pass the UPCAT, the very difficult UPCAT, who did not proceed to UP, and 40% said because they have no money. And so this year, we opened a new program called Lingat Aral for these students, qualifiers from GIDA, or Geographically Isolated and Disadvantaged Area. We are providing them 90% subsidy for food, allowance for food, 90,000 pesos a year for food, 30,000 for dormitories or dorm, and 10,000 for communications, and 10,000 for transportations. And we already have about 100 beneficiaries from this, and this mattered a lot in terms of changing the complexion of the student composition in terms of social background. The other thing that we introduced is the UP Vinta, or Ventures in International Transformative Academia. We are opening this program in the UAE, in Qatar, in Japan, in Hong Kong, in Taiwan, in Singapore, and Thailand. 7, I hope we already opened in Taiwan and Japan and Thailand and Hong Kong and UAE. The idea of UP Vinta is to offer free online education to OFWs who didn't have a degree. It includes as well micro-credentials. The idea is for the Filipinos who want to upgrade their careers overseas, they can avail of free, if they're Filipinos, up to PhD degrees. But the idea is this: we want to move masses of OFWs from lower paying jobs to higher paying jobs, from higher risk jobs to lower risk jobs, and reduce the cost of welfare services, because it has been proven that the better jobs, higher paying jobs, are lesser in terms of risk. And also, we want to help increase the number of remittances, which at last count is already 38 billion a year, or that's about 10% of our budget. And so this is the grand scheme for UP Vinta, if it works, and it offers practically a program where cost marginally approaches zero because it's all online. So this is one of our initiatives to advance national interest through OFW protection and nurture. The other one is, among our other, we have submitted it already, our list of achievements, Madam Chair, but I would like to mention that during the Typhoon Karina 3 weeks ago, our project NOAA under UP Resilience Institute has already an application or flood maps where you can determine where the floods are coming. During Typhoon Karina was when Manila was flooded. Our applications developed in UP got 2.6 million requests for downloads, and the feedback really from the population, it has really been a great public service to many people, because you can drive around Manila and plot your route based on the signals that you will get from your flood map. And this is a project of UPRI under our Dr. Mahar Lagmay. And then we have a massive online course. We have established MOOCs, massive open online courses, and one of them is the Basics of Resilience, where in its first offering, 11,000 students were admitted from the entire sector of Philippine society, from civil society organizations, NGOs, NGAs, local government units, and academics. And this shows that in terms of resilience and climate adaptation and disaster risk mitigation, there is increasing interest in the entire spectrum of our society. And also, I already mentioned the PGH. And among the projects, what we would like to do is precision medicine. We have requested in the budget a budget for 5,000 test sequencing, 5,000 Filipinos to be sequenced every year for 5 years from all ethnicity. This is 25,000 to determine the Filipino genome. This is in terms of sequencing the Filipino gene. This has very significant impact on not just national identity and national identity building, but as well as on health, because there is a partner project here on determining the Filipinos based on the gene sequences of our different ethnicities and comparative to those who are healthy and sick. We can introduce precision medicine in the country, which is going to reduce the health costs. I do not have the figures on how to reduce, but because this is still a project, but we are trying to determine the propensity of Filipinos based on their ethnic identities, based on the sequencing of their genes from some of the most popular killer diseases in the Philippines, which includes hypertension, diabetes, cancer, particularly. I would stop there, Madam Chair. I have raised, and thank you very much for your time.
Like I said, I'll ask my questions later, but in the interest of just completing the UP presentation, can I ask Dr. Gap to just give us any updates on PGH, and then I'll give the floor to the senators present.
Thank you, Madam Chair and honorable members of the Senate. I think I'd like to start by saying that PGH is probably a case study for the basic principle of development follows money. So we've been fortunate to have been granted very generous budgets in the last 9 years that I've been director. And I'd like to just make mention that the budget of PGH now is enough to make everything free for patients, from the basic care to the most expensive interventions that we can do. And it has also allowed us to have substantial savings and income at the end of the year to flow back to the patients and to construct and to buy more equipment, which now adds credence to the fact that maybe health is really a good investment for our country. Just to give you a few examples of this, a patient, imagine a market vendor along in Paco suffering a heart attack, goes to the ER of PGH. In the same hour, she will be in the cath lab and she'll have a stent in her heart, and she will not spend a single centavo. So that's how it is now. And I think it is being done all over the country by our hospitals, also well supported by this new fiscal management. I think the highlights of the last few years in terms of services will be down to the fact that the more expensive interventions, which are also important, are now available to our indigent patients. That's in conjunction with our basic philosophy of running government hospitals of health equity. Just examples, the first patient of robotic surgery in PGH was on a jeepney driver. We are now able to give cochlear implants to children who never had hearing before, which costs around ₱1 million per implant. We are now able to implant deep brain stimulation unit devices to patients with LUBAG, or the X-linked dystonia of Panay, a very unique Filipino disease. And also, we are able to do all the advanced diagnostic tests. We just opened the first government-procured PET CT scan in the country 2 months ago. And there's a growing list of interventions for our patients to make it more convenient for them. A breast cancer patient now can have her tumor taken out during surgery, and at the same time have radiation exposed in the operating table, lessening the need to go for radiation after surgery. No? We have the only one in the country and maybe only two centers in Southeast Asia, which is a center of excellence, the high-intensity focused ultrasound device that is now attracting even foreign patients to PGH. We just did the first Australian pilot who came to PGH as part of our medical tourism program also to have this treatment. The impact of mental health is also being addressed. We just installed the first transcranial magnetic stimulator equipment that sends electromagnetic waves to the brain to allow patients with depression, obsessive compulsive disorder, and even addiction have a faster healing time. We are not only expanding our services, but of course, even research, which is our also mandate and teaching. Because of the support, Madam Chair and the honorable senators, PGH has now increased its research output from 300 papers to more than 600 a year. And I think more importantly, we are now publishing from a low 8% per year in 2016 to 81% now. So I guess that contributes to the total research output of the university. You know, we have eliminated also the pharmaceutical support for doctors. That's my personal advocacy. So now, because of the funds that we have, PGH pays for research presentations of our doctors abroad and training. No, they don't have to ask, you know, when they attend a conference, they don't have to be sponsored by drug companies anymore. So I think that helps, you know, in the proper upbringing of our residents. And we have been successful in getting more plantilla items from the DBM-DOH plantilla staffing pattern. For the first time, having salaries for our fellows, MO4s, and midwives. No? Since the history of PGH, never have our midwives had salaries corresponding to their professional status. No? Our training component also is being partnered with DOH, being a training hospital. We have opened our programs to affiliate trainees from DOH, wherein they bring their salary with them when they train in PGH, and they have a contract that they should go back to their province of origin or hospital origin after their training. And this is all part of the universal healthcare partnerships that we have all over. In fact, we just piloted what we call a task sharing answer to the problems of manpower. In Batanes, they have a CT scan, they have an MRI, but they don't have a neurosurgeon. So if you suffer a stroke or have a serious head injury, ang tawag nga ng doktor doon Doc, ano lang kami, OOTD. Ano ho yung OOTD? OTD, observed to death na lang ho kami. So we piloted this year what we call an outcome-based neurosurgical training, emergency neurosurgery training, wherein they sent a general surgeon. He spent 4 months with us, and I personally assisted his surgeries just to make sure he's learning the right technique and the right way to diagnose patients. And today, well, there's a typhoon. He's supposed to go back to Batanes and start operating if needed under our supervision through telemedicine, because Batanes has Starlink now. So I think that's one thing that improved also their ability for telemedicine. So these are all part of our participation in the Universal Healthcare Program. And I think the next step will really be expanding PGH to be available to other regions, starting with our new Clark City facility, which is now poised to be the Sports and Wellness Medical Center in that area, having its location near the sports arena and the water arena. And you'll be happy to note, Madam Chair, that we are servicing the 200 student athletes we have in the National Sports Academy for their health needs. UP Diliman will have a PGH Diliman, and we are getting numerous offers for joint venture project proposals. I'm leaving this after tonight to go to the UAE to present to the King the project in PGH Carmona, which will be the occupation and industrial hospital of that area, and will be the first truly advanced government center in the Calabar zone. So these are just some of the developments that's been happening in the last 9 years. And before I end, may I just make another plea for another state university, which is the West Visayas State University Hospital. You see, Madam Chair and honorable senators, there are only 2 state university hospitals in the country, truly designated as one, PGH and WSUH. We are not under DOH. So we get our funding from the universities where we are attached with. PGH is just lucky that, it is an old institution and a national institution at that when it started. But think of a small hospital, 300-bed hospital like West Visayas State University. He also aims to train and teach the future doctors and the future specialists, grappling for funds because it has nowhere to go. But the funding of CHED, and also there is no definite budget that DOH gives to the state university hospitals from the sin taxes that we pay. So I'm having known that we will soon have maybe 20 or 30 colleges of medicine. I think it's really important for us to think of developing a track for state university hospitals. I remember in the hearings, Madam Chair, of the Dr. Para sa Bayan Act, I think it was Senator Villanueva who pointed out that the state university hospitals should have major hospitals which will be training hospitals. And I think that's going to happen soon. And since state university hospitals are not part of the DOH Health Facilities Development Program because we're not under them, I think it's time to start our own track of development for state university hospitals, because when all of these med schools are up, we have to make sure that the hospitals that they train in are standard. They're all either Harvard or Stanford or NUH standard at least, so that we are putting out the same medical students or the same resident students wherever they are in the country. PGH has no monopoly on intelligence or good intentions. I think if we band together, and I've had meetings with Dr. Helito of West Visayas State Universities. I think it's a reality that will happen soon when the medical colleges are up and running already. Just to prove to you a point, Palawan State University School of Medicine doesn't have a tertiary hospital. So they were given approval because they're going to go to PGH for their clinical years. So I think that kind of a system we have to start developing also soon. So maraming salamat po at sa aking 9 na taon na pagsisilbi bilang director ng PGH, na natutunan ko na hindi po pala masamang mangarap dahil nagkakatotoo ang iba sa kanila. Maraming salamat po.
Thank you for that. I'll save my questions for later.